Hello, my name is Andrea Romero and I will be presenting on Italian healthcare. So an overview of Italian healthcare is that Italy is a healthcare system that is organized by the National Health Service or Servizio Sanitario Nazionale, established in 1978. It's organized into three different levels, national, regional, and local. It provides a universal coverage that is largely free at point of service, and it is largely funded by citizen tax revenue. And in the year 2000, Italy was ranked it was ranked the second best healthcare system in the world by the World Health Organization. Okay, so this chart really does break down Italian healthcare. So we'll go ahead and review it. So it begins with the citizens. If you follow here, the citizens pay two different types of taxes, regional tax and national tax. And this will fund the national budget and then the regional budget. And the national budget will go ahead and be distributed to the parliament, government, and the Ministry of Health. The Ministry of Health will then go ahead and provide funding for the National Health Council and then these subdivisions. The regional budget will go ahead and fund the regional government and then the regional health department, and then this will all have an influence on each other. At the end, we do have the local health authorities, or the ASL, as you'll hear me refer to it. This will go ahead and fund the public health and community service and then directly managed hospitals here. And then if you do see here, the service flow of what the ASL will provide is the list price for pharmaceuticals, capitation for service fee for general practitioners, a global budget for hospitals, enterprises, and teaching hospitals, as well as funding for global budget activity base for private accredited hospital teaching, and then a global budget activity based funding for the IRCCS. And then you see here, everything will all be connected to the patient. So every service that each subdivision gets will go to the patient. So the public health, pharmacies, general practitioners, public hospitals, direct managing hospitals, everything will go directly to the patients. And in return, the patients will pay a set price for pharmaceuticals. They'll pay co-pays when they see when they go to public hospitals, when they receive ambulatory care. It's very basic and very straightforward and easy to understand. Okay, so financing for the Italian healthcare system is done through the National Health Service, through national and regional taxes, as mentioned before, supplemented by co-payments for pharmaceuticals and outpatient care. Public financing is accounted for 75.8% of total health spending as of 2014. What is interesting about Italian healthcare is that they have a cost share system, meaning that there's a set price for every type of service that they are receiving. For example, diagnostic care, or what they call investigation care, has a ceiling or a fixed price for what they will be charged by law for their type of service. So again, for diagnostic care, they will be paying approximately 36.15 pounds, or in American dollars, $46.66. So that is the cap that they can pay for diagnostic care, in contrast to the US care, where diagnostic testing can be upwards to the like thousands without insurance. So I found that pretty fascinating. each region differs in price too. So there's rules for every region, which is also interesting. So regions differ in terms of demography, economic development, the healthcare infrastructure, and health expenditures, with a clear cut of north and south divides. Uh, the National Health Service combines public financing with a mixture of public and private provisions. And so the ASL is responsible for allocating the budgets of how much does one region get versus how much another region gets, which is very interesting and has caused issues among Italy, unfortunately. Okay, so the similarities between the US healthcare and Italian healthcare are very limited. I did have an issue trying to really crack down on their similarities because they are so different. But what I did find was that even though Italy is primarily universal, they do have a type of private insurance if Italians do wish to have private insurance for quicker care. But only about 15% of Italians have private insurance. I also found that, like the US, they don't pay for all types of services like cosmetic surgery, ritual circumstances, non-conventional medicines, taxations for employments, and purpose over 20 types of physiotherapy. As this might sound familiar for US healthcare, as you know, many insurances or most insurances will not pay for cosmetic care. That is strictly out of pocket, so you'll find the same there in Italy. Also, in 2010, the Obamacare or the Affordable Care Act bared very similarities to Italian healthcare because it was an attempt to create a type of universal health care where it mandated that all citizens should be constitutionally guaranteed free health care. The law also relaxed standards to qualify additional members of people for Medicare through many states. Although many states chose not to implement Medicare expansions based on 2012 ruling of the U.S. Supreme Court. So even though we did see Obamacare kind of fail, and not necessarily fail, but it wasn't as big of a success as people thought it should be. But the idea of a universal health care does resonate and does bear striking similarities to Italian healthcare, which I thought was interesting. Okay, so there are several differences between the United States healthcare and the Italian healthcare system. In Italy, you'll find again that there is nearly universal healthcare coverage for their citizens. It's tax funded, and as we were speaking about in our earlier slides, it's broken down into three components. The national, which is responsible for the Ministry of Health, which is responsible for prevention, research, and international relations. Department of Planning and Organization for the SSN, which is healthcare planning, health statistics and information, medical device, pharmaceuticals and services, and the safety of care. The Department of Veterinary Care, Food Safety, and collegial organs for health protection. And then we go into the regional aspect, and there are 19 regions and 2 autonomous provinces sharing planning, and finance responsibility within central government of Italy. And then in the local aspects within each region, there's a responsibility for organization and delivery of services that rests on geographically and population defined institutions that are put together by the ASL. And then in the US, you see it completely different, where there is managed care, and managed care is defined as an organized approach to delivering a comprehensive array of healthcare services to a group of enrolled members through efficient management of services needed by the members of negotiation of price or payment arrangements within providers. So it's financed primarily by employers, the government, or self-funding, so people who are self-insured. Insurance is defined as Blue Shield or Blue Cross, or people who are self-insured. Most insurances will determine the risk of the person being insured. It'll define the type of care that each member is going to be allocated, whether it be physician, hospitals, or diagnostic care. We do see a PPO where you get more freedom and in choosing your physicians, and you just have a more variety. And then you have your HMOs where you are a little limited, but it is more affordable for some people, but you will get a high deductible. And then you have your government care, such as Medicare and Medi-Cal, that it is government funded. However, not everybody will qualify, which makes it completely different from Italy, where basically everybody is given that right for universal care. And then you have your payments that the insurances will pay for their agreed portion of their plan with each member. Unfortunately, they are high payments at times, and the cost of treatments can be very extreme depending on the type of care the patient is receiving in the United States. And it's very unfortunate because it can leave a financial burden for patients who are very ill. And it's very unfortunate versus Italy, where terminal illnesses are pretty much for all purposes covered. And my personal opinion about Italy is I like it overall. I like the fact that hospitals and primary care are usually free of health. Italians do have an option of getting private insurance if they do wish, so they do have some sort of liberty if they want, but only 15% of Italians do end up choosing to get private health care. So what I also found cool was that Italy has converted into a national law um, in the European Union Directive of 2411, where patients can receive health care across their border. Citizens can receive health care across borders. They do, as I mentioned in the beginning of my presentation, they do allow non-citizens or undocumented immigrants to receive urgent care free of charge, pretty much, which is awesome. They do have a medical record system called the National Database of Hospitalizations, which was also very interesting, and would be a nice presentation for another day because it was really interesting reading. What I didn't like was despite the country's federal structure, most regions cannot fund healthcare on their own. So it's not self-sufficient. It really relies on central transfers to compensate for the differences in regional incomes, because some regions are poorer than others, so that does become an issue. Regions also allocate their funds differently. Some southern regions still are suffering large deficits, with secondary care favored over primary care. Appointments are very difficult to get in Italy, as where follow-ups and checkups are usually rare. And the wait list times can be a huge issue for Italians, and most doctors do not speak English, which can be an issue for travelers, but for an Italian that might not be an issue. Lastly, does Italian healthcare meet the needs of its citizens? And I think it does, and so do Italians. Opinion polls show that a majority of the population supports the principles of current center-right government. The and what I was researching is that the healthcare system is constantly looking for ways to ensure that cost allocations are fair in the regions, although there has been issues in the past where certain regions feel like they are being undercut. But there is an effort with the national healthcare to ensure that the citizens are being treated fairly. Most Italians are satisfied with their service and of free healthcare. Uh, the only issue that Italians are having is that 36.4% of people feel like the wait time is too long. Uh, and then 17.5% believe that if wait times were shorter, the quality of healthcare would be better in Italy. I was reading that some facilities make patients wait up to 60 days to get certain types of treatment, which can be detrimental for patients who need care now. But other than that, I really like Italian healthcare, and it would be great if some of these uh, portions of Italian healthcare were implemented in the US. Okay, and here are my resources and everything that I discussed, and that will conclude my presentation. Thank you.